Hey, good morning or good afternoon, everyone. I'm Meredith Meacham. I'm an assistant professor in the Department of Psychiatry and Behavioral Sciences at UCSF. Our first panel is updates in social media research, data sources, and considerations. And we have a great set of speakers who work at the intersection of sociology, computer science, and public health. And I think we're going to have a logistics slide after this. Oh, first we'll do objectives. So the objectives for this session are first to understand strengths and weaknesses of social media data. For example, when can social media data answer a research question, and when is it maybe not so useful? Another objective is understanding scientific decision making when choosing a data source. So how to choose specific social media data, when would it be useful to combine social media and other more traditional data, and how to balance feasibility and rigor. And finally, considering various methods for how to analyze and access social media data. Next slide, please. Logistical reminders. So each speaker will introduce themselves and they'll have 10 minutes to speak. And then at the end of those 3 10-minute sessions, we'll have a moderated Q&A. So if you have questions, please put them when they come up in the Q&A session, and then we'll reply to you via text or answer your question live. You can also use the chat feature to talk with other attendees, panelists, and tech support. And next slide, please. So our first speaker will be Chris Bale from Duke University, speaking on political polarization and social media.
Thank you, Meredith, and thank you to all the organizers for having me here. It's great to be here. Sounds like it's going to be a great conference, and I'm honored to be a part. As you can see from the title here, I'm not going to talk much about health today, which I know is everybody's core interest here. And actually, it's actually sort of one of my own interests as well. I'm a sociologist, though I've done a lot of work in the field of health communication, specifically looking at organ donation and autism spectrum disorders, and basically various social media campaigns to try to optimize outreach in both of those kind of advocacy communities. But given the current moment and the challenges ahead, I thought folks might be most interested in hearing about more recent research I've been doing on political polarization and social media, which also I hope will offer some new examples of how we can fruitfully combine social media data and survey data, and also use bots for field experiments. So if we could skip ahead to the next slide, please. Probably most people on this call won't be surprised to see these figures, which demonstrate the kind of broadening gap between Democrats and Republicans in the ways that they kind of answer questions about social policy issues. So these include a lot of different issues outside of health, things like the environment, racial discrimination, government regulation of the economy, and so on. And kind of the take-home point is that we've seen this broadening, which is actually even more pronounced if we look at intergroup attitudes. So if we look at what Democrats and Republicans think of each other, we've reached unprecedented heights in negative attitudes between those two groups. If you could go to the next slide, please. So what many people here today are interested in, I think, is the role of social media in shaping all sorts of different behaviors. But certainly social media has become a locus of concern about polarization because of the concept of echo chambers. So here we're looking at a Twitter network. The nodes that are red are Republican opinion leaders, people like elected officials, journalists, advocacy organizations, and other kind of actors. And then in blue, of course, is Democrats. And the concern, of course, is that we tend to cluster with like-minded people, and that this, many people think, inhibits our ability to hear the other side, listen to the other side, and recognize that there can be kind of two sides to every story. Next slide, please. So 2 years ago, I started an interdisciplinary initiative at Duke, where I work, which is called the Polarization Lab. We are a group of social scientists, statisticians, computer scientists, and data scientists trying to develop real-world interventions to both understand how social media polarizes us and then also develop new technology to try to beat back that trend. Next slide, please. So our first thought 2 years ago was, wouldn't it be great if we could break people out of these echo chambers? And so we designed a study that combines kind of naturally occurring social media data, survey data we collected with a major national firm, network data we collect from the people in the survey, and then a variety of other types of data in an experimental framework that ran in the real world outside the lab, so-called field experiment. So in October 2017, we recruited about 1,200 Republicans and Democrats, and we asked them to complete a survey about their views. We actually used the same questions that I showed you at the outset of the presentation, the one that showed the widening gulf between Republicans and Democrats. Then 1 week later, we offered about half of them financial compensation to follow a bot that they were told would expose them to messages, 24 messages each day. All the people in this study were Twitter users in the US over 18, and we obtained informed consent from all of them to do this study. But they were not told that the bot that they were going to follow was going to retweet messages from the opposing political party. And for 1 month, we monitored whether people were paying attention to the bot by weekly surveys that asked them if they could recognize certain messages and images that the bot retweeted. And then at the end of the month, we resurveyed them using a similar survey, and we were able to estimate over that time the effect of, if you will, kind of stepping outside your echo chamber on your political views. And of course, we hoped that this intervention would lead to a decrease in political polarization as people started to appreciate that they're stuck inside an echo chamber, or maybe that they haven't seen the other side. And certainly anybody following COVID right now can see examples of this, if not in your own feed, then in kind of the broader public sphere, you know, whether COVID is being defined as an issue of science and public health and coordination, or in terms of the economy, or in terms of China. And we can certainly see parties taking different positions on these different parts of the issue. So I'm going to talk a little bit more about some of the unique features of combining survey data and social media data in just a minute. But if we go to the next slide, I also wanted to highlight one of the unique features of this study is the Twitter bots themselves. We created these bots by sampling prominent elected officials, scraping the names of the accounts that they follow, creating a large network, and then pruning that so it only included people who were either elected officials themselves or were followed by at least 10 elected officials. We then hosted a bot on an Amazon server, and once an hour, it drew a random name from the other side, from the Republican side, if it was the Democrat bot, or vice versa for the Republican bot, and retweeted these messages. And we were then able to kind of simulate exposure to the full range of opposing views on all sorts of different issues. So we weren't controlling what the bots tweet, we were simply retweeting members of the other side. So our hope was that this was a relatively realistic field experiment that would simulate a kind of real world setting. Before we went into the field though, next slide please, we discovered some kind of both challenges and advantages of linking social media data and survey data, which I thought I would go over for a moment here. The first is anytime we run an experiment or do even a simple multivariate regression, we make an assumption about how our units are independent of each other. That is, that people in our study aren't connected to each other. And we usually make this assumption without looking at it, but if we have Twitter data linked to survey data, we're able to pull the network data for each person in the study and actually look at whether that assumption holds. We used YouGov, which is A- rating from 538, a very kind of well-known firm that does a lot of prominent polling. And of the 1,600 people we originally recruited for the study, we discovered that 138 of them were either linked to someone else in the study on Twitter or part of a large component. A network component is kind of a cluster of users that you can see in the middle here. And this creates all sorts of problems for causal inference and making sense of what these data mean, right? What we think might be an individual effect could be a peer effect or a network effect or a cluster effect. And it's even worse for an experiment, because if we treat one person in an experiment, but not the other, and then that person starts retweeting our treatment, the other person could get exposed to the treatment. And then when we go to subtract the scores of the person in the control condition from the people in the treatment condition, they look exactly the same. And it looks like our experiment didn't work. So we were able to, by linking these data, drop the connected components. We were also able to discover people who were providing fake information and incorrect Twitter accounts. We actually identified another 40 or 50 of those. So that one of the main take-home messages I'd like people to take from this work is that we can use social media data to try to get at data quality issues with conventional survey data. Okay, I'm running out of time, so I'd love to wrap up with the next slide, which shows the results of the experiment, which unfortunately indicates that taking people outside their echo chambers did not make people more moderate, it made them more extreme. So for Democrats, this is a tiny effect that actually wasn't statistically significant. For Republicans, however, this is a substantial effect on the order of a standard deviation on a 10-item scale that looks at political attitudes that increased the more that people were paying attention to our bots. I don't have time here to go into the story of how this happens, but if you go to the next slide, I have a book coming out in April called Breaking the Social Media PRISM, which provides a lot more detail about the, next slide, please, that provides a lot more detail about both the research methods I described today, but also a theory of social identity and social media that explains, I hope, why we observed this counterintuitive and fairly depressing effect of our intervention, and also provides some new solutions, new techniques, new ways of pairing people and stepping outside the echo chamber that our Polarization Lab has discovered can move the needle in the other way. So next slide, please. Once again, I'd like to thank the organizers. If you'd like to learn more about this work, you can visit polarizationlab.com, or if you'd like to check out some of my earlier work on public health communication, please visit my website, chrisbale.net. And I look forward to hearing from the other panelists and speaking with all of you in attendance in the Q&A. Thanks.
Great, Chris. Thank you for that that really interesting talk on doing a field experiment on Twitter and some of the challenges you ran into. And that book sounds really interesting and timely. So if you have any questions about his talk, you can put them into the chat or the Q&A. And looks like we lost the screen sharing, but our next speaker will be Rumi Chunara from NYU, and maybe she's going to be sharing her slides.
Yeah, thanks, Meredith, and thanks to the organizers for inviting me. Yeah, really excited to chat with everyone. It's a great topic and glad to see you bring it together for this conference. I'm just pulling up my slides. So hopefully you can, Meredith, can you see everything okay?
Yeah, just bring it full screen there.
Okay.
Looks good so far.
Right.
There you go.
Great. Okay. So yeah, so I thought I would, you know, everyone here works in, you know, has some overlap with health. So I kind of didn't want to spend too much time on that part of what I usually preface things with, but I just wanted to provide a little overview first as to kind of the way that at least my group identifies problems and the data sources to work with. And so that hopefully will speak a little bit towards our vision for where social media is fruitful in health research. Of course, we've seen a plethora of types of data relevant in health, and I especially highlighted a lot here related to respiratory infections. You know, as everyone knows, it's COVID, and there's been a lot of activity in terms of data for looking at disease outbreaks, acute disease outbreaks, and efficacy as interventions. And besides, of course, social media, which we know could be relevant, we have a lot of more data sources like online surveys that people fill out. We've seen a lot of that over the years, just in terms of influenza. So that's a little bit more active participation where people sign up and then on a weekly basis, they'll report what kind of symptoms they have. And at least that provides like a specific cohort for questions and kind of like a defined denominator where you can know a little bit more about the people contributing data. But yeah, there's also social media data sources and other kinds of observational data that we can leverage. Here, I actually just highlighted a couple projects from my group for the purpose of actually just showing what other types of data we can even successfully garner from individuals in the community. And so, social media, I don't know if this counts, but also there's a lot of like applications people use to, track their physical activity. And so on the right-hand side, just the purpose of showing this map is to just show the kind of how ubiquitous these things are around, like New York City is a unique case, but you can kind of see basically every street has been traversed by someone, where we aggregated data across multiple physical activity tracking apps. In the bottom is also, and it's funny how now this is so regularized during COVID, but where just the idea that we can source microbiologic information from people in their homes just a few years ago was something new. And actually, this is relevant too, because we can kind of use this in a way to validate syndromic data or other data reported over social media. And I'll talk a little bit about that later. So the bottom just shows the example of types of specimens that people, and probably many people have collected these themselves. At least here at NYU, we do the saliva collection every couple weeks nowadays. And the right side just showed kind of what information we were giving back to folks as part of this trial back in 2014 to share information with them about the different types of viruses and kind of how those were changing over time. And so here's kind of that crux where I wanted to make a little comparison. So in public health, population health, where we're thinking about all of the multi-level factors that people, that affect our health, typically, governments reports, large denominator-based surveys like, BRFSS in the United States, the DHS worldwide. These things are great and robust because they cover specific catchment areas. They're representative of whole populations. The kind of information they garner is really curated, what variables they're validated. But on the other hand, and they're collected on some kind of regular basis, whether that's annually or otherwise. But on the other hand, as you can see, because it takes a lot of effort to generate these data, capture them, they really will lack on speed when we need to know things in kind of a rapid manner. They could lose out on sensitivity because we might not capture all possible true positives because of people don't want to share that information. Maybe they don't feel comfortable. Maybe they're not captured. A specific outlier is not captured in the survey. And of course, there's a heavy cost and time and resources for those kind of survey efforts. And to the last point, it is actually really important where there's not much public engagement where you just kind of deploy a survey and ask people to fill it out. It's not, yeah. So, but on the other hand, like social media amongst these other crowdsourced data sources kind of have these other positives and other challenges, right? Where we all know they're not reaching entire populations. Sometimes we don't even know who is in that denominator. But on the other hand, you can give like a rapid signal, maybe a very localized signal, where otherwise it would be hard to get that type of information. So we kind of keep these challenges and opportunities in mind. And so and what I wanted to do next is just give a few snapshots of some places where we kind of leverage these advantages of social media data, as well as a few other things we're thinking about going forward. So this one is really thinking about time and how, even our understanding of, behaviors are important in health, but what we know about them today is really limited by the tools we use to measure them, right? And so this very, of course, this important theoretical model of behavior change, which folks might know about, just kind of outlines how we make behavior changes and kind of says these, we can think about it in terms of these discrete steps. But of course, we know that behavior change is not just linear like this. Like there's a lot of, I'll maybe make some decisions one day and then another day different decisions. So there's a lot of change over time. And those things are, even within a day, we have different stages within our where we are in terms of choosing to do different behaviors or lifestyle type decisions. And so this is where we thought social media could be useful. And these are just some quick results. So I'm not even going into the details of how we got them. I'll share the citation and happy to chat more. But what I wanted to basically show is, and the top graph just shows it's the days of the week, and the bottom graph is like showing within some days by hour where people are in terms of a certain behavior. In this case, it's alcohol, and so consumption. And so we use the fact that the timestamps on social media posts can help us see these things very rapidly. And the utility is that we actually could distinguish between different types of folks, like male or female, in terms of where they were most likely to talk about alcohol consumption online, and even over time, like a specific event like New Year's, when you would expect there to be a lot of changes. We could see how people go through that process of talking about planning to drink alcohol and then to actually doing that and then reflecting on it. So you can kind of see those behavior changes in this very acute time. And of course, that's potentially relevant when we think about like really timing any kind of intervention or information to folks to help them in a decision process. Okay, so I'm just watching the time. Yeah, so the next one I wanted to look at was more on, instead of time, now looking at location-wise. And again, in public health, we have the need for a lot of very localized information. There's a lot of text on this slide, but I'll just briefly motivate it for you. And this is in a very very important topic of discrimination, which we know can get under the skin. So there are downstream health consequences of discrimination. I won't go into those pathways, but certainly a lot of experts have studied those a lot. But so what we would like, what is in the literature on discrimination, and from my understanding and working with colleagues, we need better objective measures of discrimination as well. And as well, we know these things can vary dramatically by neighborhood to neighborhood, right? And so this is one place where we also thought there could be advantages to looking at social media data where, potentially you have good geolocation of information, and it's a place also where people, would share things like discrimination where they're discriminatory comments where they might not do that on a survey. Now, of course, there's challenges because every place there's not the same amount of Twitter posts. There's questions about what people share online, how that relates to the real world environment. And so I'll show a couple efforts that we're looking at in order to better understand those things. So yeah, so this kind of motivates what we need to do in terms of addressing some of those challenges. We need to kind of figure out what's the actual sentiment in particular areas based on these like noisy and not evenly generated tweets. So this goes into the methods. I'm gonna actually, because of time, I'm gonna not go into too much detail, but the citation's here and I'm happy to chat about it more, where we basically create a method to basically cluster kind of tweets in the way that you identify places that have the most common representation. And so you can say, well, this place has this kind of level of discrimination versus another place. And so we show that in like around New York City again, where there's variance in these things, there's a sufficient volume of tweets. And the left hand just shows what that discrimination would have looked like if we just used like zip codes, which are, administratively defined boundaries, versus on the right where we kind of use that clustering to identify the regions with more discrimination. You already can see that you might have a lot of spatial averaging if you just use the administrative boundaries that would generate different, areas of higher discrimination versus actually looking at the data from like just a generative point of view. And so I'll just quickly say that we also have started to look at how that discrimination online compares to other measures of offline, in this case, hate crimes, right? And so, of course, there's different pathways and connections between those two, but this was just a first look across these 100 cities, and it's a busy set of maps, but the paper shows more of the correlation and showing that, yes, certain types of online discrimination, specifically those that are targeted, right, not just people reporting they experience discrimination, are related to more hate crimes by city. So finally, I'll just wrap up to talk about a few other lines of things that we're trying to look at in terms of social media and health. And one of the major things is that's kind of spurred us is to understand why people share things on social media. So again, respiratory infection related. So might be folks, it's happening now, but for a long time, people have looked at online data in terms of in this case, searching for things related to flu. And, they found that there's not always a correspondence between what people are looking for online or writing online and what's happening in the real world. And so that also spurs this question about, well, what makes people share information about something? So we've looked at this in a couple ways. This paper, we actually used the Go Viral study, which I introduced earlier, and a subset of folks who also shared their social media profiles. And then so we know what their symptoms are because they did the survey on a weekly basis. We know what they talked about on social media, and we have the specimens to actually confirm what infection they got. So we can see if there's any, at least in these group of people who agreed to share all that information, if there was any correspondence. And like the title it was a little bit surprising what we found. It was a small subset, but of those people, we didn't find actually much relationship between their actual infection status and what they put on social media. So that's kind of the first study at the individual level, although often we see these kind of population correlations. We're also looking at why people share in relation to what's being shared in their network, because obviously the social environment, what you see online, can also affect what you might want to share. We looked at this in terms of food posts on Instagram. People share a lot of information about food. And I'll just quickly show, this is in Abu Dhabi, where we also looked at the built environment. So what restaurants are in your area, as well as what is in your online environment, and tried to unpack where these each had their own influence. And of course, there's different reasons the social environment can affect what you share. We didn't dissect which of these reasons it was, so I wanted to make that clear. But in the end, and this kind of just illustrates what we did, where we looked at what's in the environment, because you can imagine where there's more restaurants, people might share more about food, right? So that we would expect. But in the bottom, we add our theoretical model about what the social environment, how that might actually affect what people share as well, here as a mediator. All right, so that was just a quick snapshot of some things we're thinking about in terms of where social media might be helpful for understanding health and health research, and some other directions we're looking into to address some challenges. And I wanted to thank, of course, funding sources, all my wonderful students who do all the heavy lifting, and look forward to the discussion, and please feel free to reach out if you want to talk about anything else.
Great, thank you. That was really interesting and rapid, of course, overview of your work. And I think it was really helpful to see that kind of contrast between like surveys and reports and social media data. And I think this question of when does online and social media behavior really reflect what people are doing in their lives offline. I want to know, it sounds like there's been trouble for people renaming their participant names in webinar mode. I think we're working on that. We might not be able to get around that, but we'll work on that and hopefully have an update for you soon. So let's move on. I think if you could stop sharing, Rumi, then we can move on to our next. Thanks. So our next speaker will be Tim Mackey from University of California, San Diego. And I'll let him get started. Oh, it looks like you're in note view. or the presentations in note view.
There you go. Just swap. There you go. Looks good.
Tim, are you here?
Sorry, there we go. I think I was muted. Apologies.
Oh, no. Okay, there you go.
Thanks. Sorry about that. Again, thanks to the organizers for inviting me to present at this conference. PRISM is great. I've been here for the last, I think, 4 or 5 years, as long as it's been around. And it's a really great place to engage with people in your space in social media surveillance and social media public health research. The title of my presentation is really about moving forward towards a multimodal approach to do public health intelligence. And I'll go over some of the reasons why we should potentially use social media, some of the limitations, some case studies of some of the work we're doing in COVID, and then talk about why multimodal approaches to surveillance is where we want to go in the future. So why use social media for public health intelligence? A lot of this surrounds the topic of the broader topic of infodemiology and infovalence, popularized by Gunther Eisenbach, really just talking about using electronic mediums to supplement other traditional forms of surveillance. You could call it syndromic surveillance, you could call it digital surveillance, whatever you want to do, but there's so many different digital assets now available that people are reporting that can be used for public health reasons. And I think that's even more pronounced with COVID now that more people are staying online, more people are sharing information. And I think unfortunately or unfortunately, people are relying on online networks as their social support systems. So what we have an opportunity to do is to augment data from traditional sources like surveys to detect emerging issues, explore changing behaviors and attitudes. And the question is, how do we get the data, analyze it, and what platforms do we use? So in general, the approach that our lab takes is we take a big data approach to public health challenges by looking at multiple sources of internet data, whether they be social media, internet sites, the dark web we do a lot of work on as well. We take a lot of that data and we use machine learning and NLP to classify and curate that data. We then do the analysis from an interdisciplinary perspective in policy, GIS, epidemiology, et cetera. And then we also try to visualize the data in a way that can build potential solutions to translate into things that people can use in the real world. So as a first question, where do you collect the data? I think one of the most important things in the social media space is to pick the platform based upon potentially your user demographics. So Pew always has great research on where people are and what people use. So if you're on Twitter, because it's got an API that everyone can tap into, you're not really reaching a youth or young adult population. So if that's your target population, you may want to consider which social media platform you're interested in. If you have a specific event of interest, which I'll talk about in just a second, that may be a deciding factor as well. Your ability to curate the content either through hashtags or threads or other modalities. And then the time period, and also just generally knowing where your topic is discussed. Meredith does some great work in substance use disorder. She does a lot of work in Reddit because there are a lot of rich conversations going on about substance use disorder in that space. And also, do you want to collect it retrospectively or prospectively? So we are primarily an AWS and Python lab. And when you web scrape, you have the potential to collect data retrospectively. And also there are different APIs, of course. Most people are familiar with Twitter, the public API stream, which is prospective, versus the search or REST API that people don't use as much, yields you smaller volumes of data, but can go back retrospectively. And so this figure is one of the ones that was created by our data scientist on how we ingest data and how we classify it in our different approaches. The second part is the data analysis phase, where if you have an unexplored topic, we rely on a lot of natural language processing or unsupervised machine learning. And so that's been really critical for COVID because it's such an emerging issue. And we didn't have training sets to identify themes that we were interested in. And I think COVID really changed the game for unexplored topics that we need to identify. And then that also helps you build training data that you can feed into a machine learning algorithm or some other classifier that can help you find more of the content you're interested in. And then we do go back and do the model evaluation to assess how well the model is performing. And behind all of this is a whole bunch of manual annotators and people in my lab that really do the hard work of curating the content and coding it in a way that's very, very meaningful so we understand what people are saying. And then again, data visualization, putting it in a dashboard, and it's not that hard. There are a lot of great dashboard products out there that are free. Google Data Studio is one that's rudimentary, but it's pretty good. And then of course, Tableau, ArcGIS dashboards, etc. We use a bunch of different ones, but you should really focus on the UI UX design principles there so that people can use them and understand the data that you're producing. So real quickly, I'm going to do a few case studies in COVID and some of the work we've been doing to illustrate some of the different ways you can leverage social media and how you choose different social media platforms. Generally, what we do is we work in the space of infodemiology, which can be more about disease trends and how the outbreak is, changing from a more population health level or a regional or even a global level. We do a lot of work in frauds and cybercrime related to detecting people selling fake vaccines, fake COVID testing kits. That's a very specific classification task. And then we're doing much more work in the infodemic space around misinformation. We recently had a session we did at APHA with people from WHO, and WHO is really working hard on the misinformation topic right now. So it's really one of those things that has emerged out of this pandemic that we're going to be dealing with in the future, because as we get more emerging infectious diseases, there's going to be misinformation that comes with it. So here's a quick slide of some of the work we did at the very early stages of the outbreak. This is a paper that will be published, I think, in the next week or so in JMIR that looked at just Wuhan City. This is where the outbreak occurred originally. So in January, we started collecting data from Wuhan about what users were saying in reaction to, the pandemic as it emerged. And it was really interesting because there was a mix of news from government sources, there was a mix of media reports, and then there were user-generated content that came out of that. And what we noticed was people were changing their behaviors, attitudes, and perceptions around COVID as new information emerged. And that included deciding to social distance, decide to wear masks, other things. So this cycle of news and cycle of social media conversation does impact behavior on the ground. And this was, we chose Weibo because it's a Chinese social media platform, and we chose Wuhan City because it was at the beginning of the outbreak. So that was our rationale for choosing the social media platforms we used. And so here are some geospatial analyses that we've done on Twitter data, which I won't talk too much about because Raphael, one of the people in our lab, is going to be talking about it in a rapid fire. But one of the things here that was interesting at the beginning of the outbreak is we saw a bunch of tweets coming out of India, but there were not a lot of case counts at the time. So, that's kind of an early indication that perhaps there's something more going on there that's worth looking at in the context of, are there a lot of reports, but is there underreporting? Is there a lot of social media chatter, but is there underreporting of cases? We really didn't get to look at it because we went on and on to the projects. But this is a good example of what you can do from a geospatial standpoint to try to investigate other trends. So we've done some work looking at it from the context of specifically San Diego, also globally, and then also looking at these fake products as well. So these are just some of the examples of the dashboards we've developed around this data. And then I'll just end with this study real quickly, is that the misinformation that's been coming out from people in very high places, including President Trump, has generated a lot of research in our space. So we did a study where we reviewed 1.23 million tweets after the president retweeted misinformation about hydroxychloroquine. And what was really unfortunate is that 84% of the content we reviewed was misinformation versus, information about the actual risks of the drug. So we're seeing a lot of propagation, as Chris mentioned, these echo chambers that are occurring on these platforms. And we are not getting ahead of it as a public health community, I would say. I think we're losing the battle there. And so we're also looking at other things like vaccine hesitancy. Alec in our lab will be talking about that in a poster session. So if you're interested in that from like the perspective of tribal communities, there's a lot of interesting information that we're generating from that space as well. So this is just an example of the posts related to hydroxychloroquine. And you see this big bump after Trump did his retweet. And unfortunately, you know, the vast majority of this content was misinformation about the drug. So lastly, this will be quick. We want to move towards multimodal approaches. Social media is great, but it's just one data layer. And so what we really want to do is triangulate social media conversations across multiple social media platforms. So never necessarily just use one. Maybe 3 social media platforms are having the same trending discussions, and then we can triangulate what's going on there and what the public health risk may be. But looking at other secondary data, public records, national health statistics. This is an example for opioids and overdose. NIH asked us to look at whether we could find self-reporting of overdose because they're concerned there's underreporting. And so you can look at lots of different digital areas, including e-commerce data, web forums, chat rooms, et cetera. And then, you know, the inference phase is really that interdisciplinary component of AI, big data, GIS, and whatever you can use, social network analysis, as Chris mentioned, anything you can use to get more intelligence out of that. And those are just some secondary data sources. And then I will end with, you know, we need to have more robust validation approaches when it comes to identifying bots versus news stories versus irrelevant topics. This is the data cleaning component of social media, you know, research that not everyone likes to talk about. How do you normalize data versus retweets versus tweets? And then comparison of metadata to kind of normalize some of the data as well. There's also a lot of sample bias in social media research. So how do you normalize the data based on maybe the number of users that are using a social media platform, weighted samples based on platform and the number of users that you're, the number of posts that you're collecting at a certain period. And we just feel that, you know, if you're collecting more data from multiple sources, you're going to get better power, better triangulation, and higher resolution to your studies. Here are some references to COVID studies we've done. And of course, we're working on a lot of other issues. I want to thank the whole lab and everyone that's funded us so far. We're really fortunate to have a strong interdisciplinary group of people that are really passionate about public health intelligence and social media. Thanks.
Great, thank you, Tim. That was a really helpful overview, and I think your points about considering what platform to look for social media data and tying that into who is your target population, do you have an event of interest, and other factors like that. I want to note first of all that to change your participant name, it looks like we're going to have to log in again, which hopefully you can do after the next session, where we'll break out into separate rooms. But with the time we have left, let's hopefully get to a couple questions. I'll maybe start with one from each person and for each person, and then if we have time, one for everyone. So maybe, yeah, this is fine. This, yeah, can we go to share view instead of note view?
Yeah, go top left, hit display settings.
So first, a question that came up for Chris was why you used a bot instead of a real account for your field experiment.
Yeah, that's a great question. I mean, there's some ethical issues there. You know, we can't control real people in the same way that we can control bots. And also we wanted to involve a broad range of people, and the bot was able to retweet a much broader range of people than I think we could have agreed to participate in the study. And there might have been some kind of selection effects of who was willing to participate in the study. But I do think it would be really cool if you could, for example, convince a group of public health leaders to stagger, even by a few minutes or hours, the rate at which they tweet or something like that. You could imagine some really cool field experiments. Similar things have been done to examine media effects by political scientists like Gary King. That would be a really neat study. Obviously, it's a logistical challenge, but really interesting idea.
Great, thanks. A question that came up in for Rumi, seeing her maps was I don't work with Twitter data, but I've seen a lot of presentations with the geotag data, but I've also heard that that's a very small percentage, or relatively small percentage of tweets. So I'm wondering how you address that, or what assumptions you're making there.
Yeah, Meredith, it's a really good point. Not only is yeah, the proportion of people who allow for that to be shared is small, and I think there, as far as we know, I have to confirm, but it would be important to understand that that distribution of people is also not different in other ways in terms of what they would share from the people who don't share geolocation on Twitter. So I guess I look forward to finding or seeing a study on that, which is one of the important assumptions that we're making. And I think the other thing to comment on is, I mean, we do benefit because at least looking at a city like New York, which is big enough that the volume is fine, helps us out. Otherwise, I think even for other topics, not just in terms of geolocated data, we've had to do some really like active learning, like basically finding related data and then really tweaking our classifiers to make sure we retrieve as many of the items that we're looking for. We had to develop some algorithms to do that in particular because it's an issue.
Great. Thank you. I think we only have time for one more question. And if you do, I saw a lot of questions go by in the chat. If you put them in the Q&A, then I think some of our panelists might be able to answer them there. And this question is for Tim, but if Rumi or Chris want to jump on if we have time, that'd be great. So there's a question about getting data from non-Twitter sources. And it looks like you use Weibo for some of your work. And yeah, if you could speak on any tips or challenges in getting non-Twitter data.
Yeah, I think we primarily rely on web scraping with pre-selected searches. And fortunately, a lot of these platforms have to have a UI UX component to them or people won't interact with the platforms. So we use a lot of web scraping, but we will use also combinations. So on a project that was funded by Google for YouTube, we used a combination of their limited public API and a web scraper to collect a higher volume of data and triangulate the data. We also split instances on AWS to get more yield. So there's a lot of different approaches. Obviously, people use the Twitter API because it's the most robust, but you'd be surprised that not a lot of people use the Twitter REST API or Search API as much when there are options there as well. I think there's sampling bias with all of that, and we just have to be clear that there are limitations to how we collect data, whether it's through web scraping or through APIs.
Great, thanks. Again, if you have questions, feel free to reach out to the speakers or put them in the Q&A. Maybe we don't have time for that. Chris just noted for learning more about these techniques for social media data collection and analysis. He helped run and started the Summer Institutes in Computational Social Sciences. Actually participated this year, and there's a lot of helpful videos, interaction with participants, and then publicly accessible GitHub coding repositories.